Hey friends, welcome back to Thrive in Line Healing Podcast, episode 56. This week, we've been on a neurotransmitter hormone journey. So we're just going to keep with it. We're going to talk about birth control. Remember how birth control is kind of only one of the two tools that a lot of gynecologists use to address hormone things in women, and how it can be impacting our mental, physical health, addressing the root cause. So again, this will be a Dr. Carmen show.
Well, I think this is important to talk about for a couple of different reasons. And I do tell folks this a lot, because more and more women are having trouble with hormones, right? And they will say to me, hey, I have a hormone imbalance. So then I ask a lot of questions and figure out, well, what kind of hormone imbalance? Because that can look like a lot of different things, but women know, we know our bodies, right? We know when things are not working well or not as they should be, right? And you're right, conventional medicine is limited in their options. There's several different types of birth control, but they're all birth control. So they all kind of hijack your hormones, if you will. Or if it's something severe, surgery, right? A lot of the options is, well, let's just have a hysterectomy, right? Let's just remove those parts that are influencing your hormones. And that may not be the only option that people have. So I'm excited to talk about this today. We're talking about hormone imbalances. It's just sort of this broad topic, right? That can include anything from PCOS, polycystic ovarian syndrome or disorder, where people are not having regular periods, right? They may also be growing hair in places that they don't want to be growing hair in. It may look like things like severe acne. It may look like endometriosis, or women who have really painful periods to the point where they can't go to work or they can't go to school, and they have to take a day or two off. Hormone imbalances may look like really heavy bleeding, right? Women who have a tendency to bleed significantly to the point where they're anemic. Or if you're having your period every 2 weeks, right? You're like, gosh, that's not normal. Or every day for a month. I have a couple of folks who've come into me and I was like, okay, we needed to do something a little bit early on, but we can still, support the body. Let's see. So from really heavy periods to no periods, people not having periods, right, for a few months, every other month, to even a year without a period. So that spectrum of symptoms, so that's just a physical side, right? That doesn't address the emotional side, right? How our mood changes with our cycles, right? From sometimes it can be like drastic mood swings, right? Sometimes people can feel they'll describe it as, gosh, I feel bipolar, where I have these really high highs and I have these really low lows, right? Or people who get really irritable or have like angry outbursts around their period. Women who have migraines to the point where they just can't function. All of those can be symptoms of hormonal imbalances or disorders.
So I think we need to take a minute and pause, because two things.
Okay.
I think you need to describe I'm not going to say normal, but what a woman, how she would experience life or her period with a healthy balance of hormones.
Got it. Okay.
Every time this stuff is presented, I feel like it's always being presented all my life at the extremes.
Yes.
Right.
Okay.
So all of us that don't have the extremes feel like there's nothing wrong with us, but we don't have that measuring, like, no, this is what healthy looks like. There's a spectrum, and this is the extreme of that spectrum. If you fall somewhere in here, there's still something that's not completely right. Does that make sense?
Yes, that does make sense. Okay, so I'm a visual person, and this is easier for me to describe visually if I share a picture.
Okay.
So, especially for our YouTube folks. Oh, you know what?
Hold on, I'll make you.
I think I can share my screen. I think. Oh, nope, not yet. I want to share a graphic with you that shows the changes of our hormones during a month's time, right? What a sort of a normal cycle should look like. And then we'll kind of go through and describe what physical symptoms or changes somebody might experience during that time. Yeah. So,
Did that work?
yes. Okay. So I'm going to start with one graphic here. Can you see my picture?
Yes.
Okay, excellent. So this is a 28-day cycle, right? And I mean, we tell folks that's just an average, right? For some people, it might be 30, 31 days. I prefer the cycle not to be less than 28. If it starts to get 25 days, then that's also could be considered a hormone imbalance.
Did not know that. Good to know.
Yes. So that's what they say, that's the average, but the closer to 28, the better off where our body is. So this is a cyclic graph. So you can see, and I wanted to share one so you could see all the different players. So there's LH in yellow, FSH in green, estrogen in blue, and progesterone in pink. And so even though this graph is overlaid with these different colors, I wanted to show it this way so you could see all the players that are changing in a average month or an average cycle for women. Okay. So this first half of the phase is what we call our follicular phase. So from day 1, which is usually the first day of our period, so that's the first day of bleeding, till day 14, what is happening is the uterine lining is starting to slough off at day 1 if there hasn't been an implantation, and the blood vessels are beginning to stabilize, if you will. And so that's sloughing off, right? It's kind of like you're losing a couple layers of skin on the inside of the uterus, so that we kind of start back at ground zero, if you will. So usually this is when our estrogen, our progesterone are sort of on the lower end. You'll see there's a little bit of a blip of estrogen here, but progesterone's usually its lowest. And then at ovulation, day 14, you have these spikes of the LH and the FSH. These spikes is what triggers that ovulation. So it triggers our ovaries to release the next egg. Okay. So when I back up, our follicular phase, so that's the follicles that the eggs are living in, they're kind of building up, getting ready to be released. All right. At this signal of LH and FSH spikes, and our estrogen spike, then that follicle releases that egg, and then the egg starts to move down the fallopian tubes. Right. Okay. For some folks, you might get a little bit of cramping around ovulation. Okay. You might get a little bit of cramping because that is the ovaries, like especially on the sides, not quite in the middle of the lower abdomen, but usually the right and left, or right or left. We usually don't have eggs that come from both sides at the same time, usually. But they will have that a little bit of cramping because they're releasing that egg, right, for ovulation. Now, if people have cysts on their ovaries, sometimes at this time, because a cyst is a follicle that isn't going to release an egg. A cyst is where it's starting to build up that follicle, but it never releases. And so sometimes those cysts can get a little bit more active on this during the follicular phase on this half of the cycle. And so if people experience pain, like I said, usually on the right or the left side where your ovaries would be, that could be a sign of cysts. Okay. So then ovulation, because your body's getting ready for that egg to be fertilized. Sometimes we will also see other changes in our body, usually like that cervical mucus. If you guys are familiar with the cervical mucus, will be a little bit thicker because it's trying to protect the egg. And if it is fertilized with sperm, it's helping to kind of keep the sperm in the right location so that it can get to the egg for fertilization.
Mm-hmm.
So during this time, so if we're thinking about it, the natural process, right? After this estrogen spike, this estrogen, you see this blue line drastically drops.
Mm-hmm.
And what comes in is progesterone. Progesterone starts to pick up. Progesterone rises, and this is usually, sorry, I didn't pay attention to these arrows. So progesterone is what it's doing. It's stimulating that uterine lining, right? So this is when the uterine lining starts to get thicker. The blood vessels that feed the uterus is starting to get grow. You're starting to get more collateral circulation into the uterus because it's growing that lining because it's getting ready for implantation, right? So if that egg gets fertilized, it's supposed to implant into the side of the uterus. So the uterus has to be ready. So this increase in progesterone here, it creates the glands to grow larger. It creates more circulation. So you've got more tissue growth, more blood to the uterus to kind of stabilize that. Okay. And then you'll see, so you usually don't notice a lot of changes. I was trying to think of what normally somebody would notice, right? You don't really notice a lot of things during this phase. And then as a progesterone, so you'll see like kind of halfway, right? Between about day 21, so about a week after ovulation. If there is fertilization, then the egg actually starts producing its own progesterone and HCG. That's what we test for in a pregnancy test. But you'll see that that as the second phase drops off, the progesterone drops, and then as well as a second spike of estrogen. So, and then if there's no implantation, then that's where usually that uterine lining sloughs off, right? Because it doesn't need to be there. There's no egg that needs to grow, a fertilized egg that needs to grow. And so then we start our period. Okay. Now, you'll see, so part of the changes in this graph that I wanted you guys also to see is that you'll see the estrogen and the progesterone. This is a ratio that we measure at different times of the month. So you can see at day 14, our estrogen is supposed to be high, our progesterone is supposed to be very low. Day 21, our progesterone should be high and our estrogen should be like middle of the road. And so this is significant because we're looking at that estrogen progesterone ratio, because if this is off, then people will start to experience, you're right, some of those symptoms that I described that may be on the extreme side, but they can be present when either the estrogen masks the progesterone. So if this estrogen never drops, or if this progesterone doesn't ever peak in the second half of the cycle, this is where you can see periods lasting a lot longer, or periods coming every 2 weeks, or periods starting on day 25, or even 21. It's usually because this ratio is off between our progesterone and our estrogen.
Okay. Yeah.
Now, while I have this graph up, when people take birth control, instead of this cyclic changes, okay, what happens is essentially draw a line right here, straight all the way across. Your progesterone is high all the time, right? Now, there are different types of birth control, whether it's progesterone or whether progestin or a progesterone estrogen combo. But essentially, when you take those, if it's a pill, you take those first 3 weeks, it is keeping your hormones high, so that you don't have the cyclic change, you don't have ovulation. And then when you go through that, the fourth week, right, that empty week, if it's a pill, usually it's that drop in progesterone that stimulates your period to occur, right? And so, I mean, periods are usually a lot lighter on birth control because they don't have the uterine lining buildup that naturally occurs. For women who take progesterone only, birth control, like the ones where it's like cyclic, you take it 3 months and you never have a period, or like the depot shots, or any of the implants, that's straight up progesterone. So your progesterone is high all the time, so you don't ever have a period. And so that's where it kind of hijacks your hormones, is because you no longer have the changes that are cyclical, the changes that happen in the uterine lining, the changes that happen in the ovaries for the follicular phase. And so your body is tricked into thinking, oh, okay, we're relying on this birth control to produce our estrogen and our progesterone, so we no longer have to produce it. Yeah. Mm-hmm. Does that make sense? Did that answer?
Yeah.
Our normals?
What would a normal hormone woman experience? Like, in terms of like, would she have, her period would be pretty, not too heavy, not too light. It would come in those days that you're talking about. Would she have cramping or not? Maybe, maybe not.
Maybe, maybe not. Some people don't feel the cramping. Yeah. And sometimes it's not as intense, so you may not feel that. Yeah. If people get headaches, usually they get headaches around ovulation, right about here, because their estrogen's not dropping off. So they may or may not. Usually a balanced hormonal response, okay, right, is that women they'll usually, if they're paying attention to their body, you will notice the cervical mucus changes around ovulation. You may not experience the cramping, and that's okay. You may experience some bloating or like a little bit like more swollen in the luteal phase, and then right before your period. And then once your period starts, a lot of those symptoms should be going away. People can still have heavy days, but when we're talking about heavy days, we're only talking about maybe 3 pads or tampons, or having to empty your Diva cup, maybe 1 to 3 times a day. That would be a heavier flow. And then usually period lasts, depending on the person, anywhere from like 4 or 5 days, maybe 7 days, but it shouldn't last more than 7 days. Yeah. You shouldn't, for a normal cycle, people may see small clots. Mostly if they're using tampons or a Diva cup, you might see small clots, but the clots shouldn't be larger than like like a pencil eraser, right? Or like half of a pencil eraser. That would be considered a normal cycle.
Yeah. So is like acne and like sometimes I get these hairs on my chin.
Yeah.
Right. Like, are those then symptoms of a not balanced hormone?
Yes. So there's small subtle symptoms. Yeah. Like it's more hair growth in certain places, or the acne that's usually occurs or gets worse right about here. So when you start that luteal phase, if you don't have this drop in estrogen, this can be indicative of a liver dysfunction. If you don't have this drop, this is usually where you start to see things like the acne get worse, because it's how our body metabolizes estrogen to testosterone. And so if we're not breaking down estrogen appropriately, it can go to other byproducts or metabolites like testosterone and DHT that causes hair growth in places that cannot, that like usually our face, our chins, on your lower abdomen and your belly. You might have hair growth. Women who get a mustache, that is usually occurring. If you're paying attention, it usually gets thicker, or it increases growth around the second half of our cycle. Yeah. Usually when people get acne, they're like, oh, I can tell my period's coming because I'm getting acne. Well, it's usually, a week or two out, because this estrogen's not dropping. Yeah, like it's appropriate.
So helpful for us to clarify, because people just think period equals acne, when acne is a sign that something isn't quite right.
Right. Yes. Yeah. Now, sometimes, like in teenagers, right, it takes a little bit for these cycles to kind of balance out. I mean, in females, anyhow. And so it may take a couple of cycles, but if teenagers and female have a tendency to have more acne, even after the first 3 or 4 cycles of getting their period, sometimes they could use a little extra support in balancing out, and making sure that their body is metabolizing what it should be, that it's building what it should be at the appropriate times.
Yes. I think a lot of women may be like either frustrated or crying right now, like, because we don't know this stuff, right? I had my period at 13 and I didn't have the extreme symptoms.
Mm-hmm.
You just kind of got like swept under, like, and nobody's talking like, hey, if you have acne after your 4th initial cycle, like, something may be wrong. If you have like a little bit of facial hair, or if you have whatever these other things are, these are symptoms of something not being right. They're not symptoms of just being a woman and having a period.
Right. Yeah. I think things are slowly changing, but
At a slug pace, I will say.
Yes. The world of obstetrics and the world of gynecology has been male dominated for decades, right? We're just now getting to the point where it's more, it's not even more yet. It's starting to balance out. Our female gynecologists are male gynecologists. And so, but even still in the conventional world, there's still not a lot of options when it comes to what we call the standard of care. And so when I work with folks, it's really, I have people map out their cycle, right? I have them map out, what are your symptoms throughout the month? Because that can directly tell us, that information can tell us, if something's at an appropriate level or not, right? So people have a tendency, just like you might get acne or hair growth, may have a tendency to get those migraines, but also people may have mood swings, those anger, irritable outbursts around ovulation, or in this luteal phase. And if they do, then oftentimes their estrogen isn't decreasing. Pmdd, right? Premenstrual I forgot what the 2 Ds stand for, but now they're prescribing antidepressants for PMDD. Oftentimes that can be because you get that usually occurs the second half of right before their period comes, when it's where people kind of feel like they're really high highs or they're really low lows, and they get depressed and it's hard to get motivated and get out of bed. Sometimes that's because this second spike is too high. This estrogen, that second spike can be higher than the progesterone. So they don't have a metabolism problem. Their liver can break down their estrogen, but their second spike may be too much, right? It may be out of proportion with their progesterone. So then they're experiencing those mental health changes because this ratio, right? It's because of how our bodies you're overproducing too much estrogen in the second half of the cycle. And so we're, taking all those things in consideration because we're cyclical beings, not just with hormones, but even our neurotransmitters we've talked about. We didn't quite introduce how cyclical they can be, but just understanding what's normal, right? And understanding what is supposed to be happening during our cycle and why it happens can be really helpful for us understanding our bodies and getting a better idea as to what's going on instead of, not addressing the root cause in these changes, but going directly to a birth control that says, okay, you know what? We're going to mask everything so we don't experience such terrible periods. We don't experience, those symptoms that are uncomfortable.
Mm-hmm.
Yeah. Or let me show you a different picture. It's the same, but it's different.
I want to tell our listeners, yes, gynecology field is becoming more balanced with males and females, but you still need to really be educated and know what you want in terms of your gynecological trajectory, if you will. Yeah. Because I mean, gosh, I've had so many gynecologists and infertility doctors, but I went to a female doctor who was an athlete and a female gynecologist, right? And that lady looked at me and told me, it's your fault you can't get pregnant because you refuse to take birth control all these years.
Oh, wow.
So because there's females does not mean they're good.
No, that is true. Thank you for clarifying. That is very true.
And then it's not my fault, bitch.
So I want to also address the consequences of long-term birth control. Okay. Before I share another graphic, is that this is one of my biggest frustrations with the world of gynecology is because they're since the standard of care is birth control, right across the board, and they'll change your birth control depending on what you tolerate. But here's the thing, it's not entirely benign, right? It's not an entirely benign treatment. So we know there are several studies that show how our birth control robs our body of B vitamins. So I tell anybody who's considering going on birth control or who's been on birth control for a little while, you are deficient in B vitamins. And so we need to supplement with that. Because your birth control is robbing your body of B vitamins, that also affects your other the health of your cells, right? So we know that B vitamins, B1, 2, 3, folate, right? B12, biotin, B7, B9. We know that those B vitamins, especially B5 and B6, are essential cofactors in producing our neurotransmitters that we've been talking about, the serotonin, the dopamine, right? Our GABA, even our endorphins. B vitamins have to be present in order for those reactions to occur to produce those neurotransmitters. Okay. B vitamins also are essential in the production of our cortisol, our stress hormone. So if we want to have a good stress response, we know we have to have B vitamins. We've always heard about B12 and energy, right? So we have to have B12, but we also need B3 to produce our ATP or to support our mitochondria to help the energy of our cells be present. And so if people are on birth control long term, and you haven't been taking a B vitamin, you're deficient in B vitamins. There's plenty of research that shows us that. I've run across one gynecologist who put somebody on birth controls and recommended a B complex. I was like, oh, finally somebody's listening, but that's been one practitioner. So educate yourself about that as well. Secondly, is that and a lot of functional medicine, naturopathic medical medicine, docs who specialize in fertility and specialize in hormones will tell you that long-term birth control use does not help your fertility chances in the future, right? What helps your fertility chances is addressing the hormone imbalance earlier on in life. Yeah. And so it's different. But I will also share with you that if people have been on birth control for a long term, for decades, 20, 30, years, and then they try to get pregnant, because the birth control has altered your hormones for so long, it takes a while to detox from the birth control to try and regulate your cycle back into this cyclic form. Okay. Some bodies bounce back better than others. I've had some folks who've had trouble with fertility for over a year after 20 years of birth control use. And so it's not an entirely benign therapy or prescription that they're offering folks.
So what about those people that have been on birth control since they were 13? They're in their late 20s, 30s now. And they've noticed that they finally come to a place that like birth control is the root cause of some of my like mental health things, my anxiety, my depression, right? And they figure that out. But because that medical community doesn't offer us any other options, like they're so afraid to go off birth control because they're afraid of the root cause has never been addressed. So the root cause is still going to be there. And so they've been told birth control is an option. You take me off of birth control, my problem is going to arise again and probably worse. So how do you help those people, or what are you going to tell these people? Like, they want to get off, but they're so afraid to because of all the consequences their body's going to serve up because of an unhealthy balance in hormones.
Right. So we can still, so this is where we get to practice and see how resilient somebody's body is, right? And everybody's body's resilient. It doesn't matter what walk of life you're in, your body's still going to be resilient. So there's still things that we can do to support a regular cyclic change in your hormones or after you stop birth control. But you bring up a really good point, because there are a lot of women who are so scared to stop their birth control because of how bad their periods were when they were younger. It's almost as if the symptoms were traumatic for them, right?
Yeah, that's how they're presenting. Good way of saying it. Yeah. Yes.
Yeah. So this idea of like, hey, I've survived for so long with the help of birth control. If I take that away, and there's the fear and the chance that my symptoms could be worse than when they were back then, that is scary, because it's like, hey, I'm putting myself in another traumatic experience.
Yeah.
And I mean, let's be honest, nobody really wants to do that by choice, right? So, but there's still things you can do. So, when some people if they want to just get off birth control because they know, it's adding to the root cause, whether they're looking for fertility help or not, there are things that we can do to begin to balance those hormones before you get off birth control, right? So, Birth control is one of those things, because it's what we call an exogenous or an outside hormone. You can go off of it cold turkey. But if your experience with your period was that it was severe and pretty intense, I usually have people consider things like seed cycling, because I'm a big advocate of food as medicine. At seed cycling, the month before they start to taper off of their birth control. And seed cycling looks at providing your body with the building blocks or the ingredients to produce these hormones, the estrogen in the first half of the phase and the higher levels of progesterone in the second half of the phase, at the right times. Right. So we know that estrogen and progesterone, they're hormones, so they have a fatty acid backbone. So they need healthy fats, right? So adding seeds, like pumpkin seeds, chia seeds, flax seeds, sesame seeds into your diet on a regular basis that month before, by doing like a good omega-3, either in the form of fish oil or flaxseed oil, and looking at something the second, especially the second half of the phase where our progesterone is the highest over here, things that are high in what we call GLAs, which is gamma linoleic acid, things like, usually you have to do this in supplementation form, like borage oil or evening primrose oil, are the two that are the highest in GLA. And you can do them throughout the whole cycle, especially depending on what types of severe symptoms people, had prior to. But you can set your body up so that when you get off birth control, you're providing your body with the building blocks, and some liver support, to help with the metabolism of the estrogen that your body's producing and from the birth control, so that the next period you do experience is not as severe as what you remember when you first started. Yes. Yeah. We can bridge that transition so that things are not as intense and as severe or traumatic as they remember when they get off birth control. Yes. But you have to set your body up for that a little bit. So I encourage people to reach out. Yeah. If they have questions or if they're in this situation and they'd like extra support, reach out, and I'd be happy, to be able to support that transition for folks. Yeah. So I wanted to share, this is the same picture, but different, right? You still see, I want to share one more picture. So you'll still see the LH and FSH. You still see the peak at ovulation. You see the estrogen spike, and then it decreases at ovulation. And then you see the progesterone increases in the second half. So this breaks down and shows you, I was talking about that follicular phase. So this is the egg in that first half. As your estrogen is increasing, it's supporting the growth of this follicle, so that at ovulation that egg can release. Okay. And then this is the lining of the uterus. So you can see that as our progesterone increases, these are the blood vessels, right, that are causing more tissue growth, more gland growth, because this is getting ready for implantation if that egg was to be fertilized. And then if it isn't, then you see the lining starting to slough off, right, after day 28. This is the beginning of your period, right? So you're starting back down at what we, could consider a clean slate or ground zero. So I just wanted to show it in a different graphic to help you kind of see the changes, because anywhere, so if people are having their periods more often, or they're having their periods where they're spotting, right, they're getting it before that 28 days. Usually it's our progesterone is declining too quickly and it's not stabilizing the uterine lining. So then we look at addressing the progesterone versus looking at addressing the estrogen. So yeah. Does that make sense?
Mm-hmm. Yeah.
All right. Yeah. So I hope this gives folks some options, right? I hope this gives folks a better understanding as to how we can address the root cause of hormone imbalances or symptoms that are around our period. Like I said, and I mean, I appreciate you bringing up a good point, and that sometimes those symptoms don't have to be severe, right? They don't have to be where they keep you from doing things, right? Like they don't have to keep you at home so you can't go to work or school or, you know, whatever, interact with your family. But if you're experiencing symptoms, then outside, I mean, if you're experiencing, it's always tricky, right? But if you're experiencing symptoms that are intense or uncomfortable, sometimes that can show us that there's a little bit of an imbalance, so we can address that. Yeah.
Or if you're like 40 years old and your face is still breaking out.
We can address that. Now I will share with you that your hormone health prior to menopause will determine how intense menopause is.
Mm-hmm.
Okay? So you will hear, well, still even gynecologists or people will share the symptoms of menopause runs the whole entire gamut, right? People are depressed, people are hyper, people are the period again comes as every day for, you know, a month or two. It comes every 2 weeks. Their period just disappears.
Yeah.
Hot flashes are intense and terrible. Night sweats, they're soaking the bed. The more disruptive your cycle is prior to menopause, the worse your menopause symptoms will be.
Mm-hmm.
Yeah. Also, our level of stress will also contribute to. So this is what I'm seeing more and more, and I think this is a whole nother podcast. But I'm seeing more and more women in their 30s, mid 30s, and 40s who are like, oh gosh, you know, I feel I'm getting hot flashes. I feel like this is menopause. Mm-hmm. And usually menopause is usually around 50, right? For some women, it does come earlier. But the more that we dig down, it's has a large component of stress to it, because of how the relationship of cortisol is produced and our levels of estrogen and our progesterone, because they're so interconnected. That the more cortisol we have, the less estrogen. And so it looks and feels like menopause, but people may only be like 35, 38, 40, 42. And they're not actually in menopause. It's actually their cortisol is taking over.
Yeah. Yeah.
I think that's a whole nother episode,
Yeah.
but yeah.
But I think I just want to convey from my perspective to women, you don't have to be on the extreme, right? If like, let my life, my 40 years, and I have my period at 13. So what is that? 27 years? 27 years of periods left untreated of, we think, estrogen dominance. Is that where we're at?
Yeah.
27 years.
Yeah.
I did not have to suffer for 27 years. And I didn't even suffer, right? Like, I don't have bad periods. I had a period every month, right? It became more and more evident that something was wrong because I was infertile.
Yeah.
And the older I got and the more these hormones are changing, it's like, oh, when I turned 13, I started getting depressed. And I've suffered from depression, anxiety, infertility, acne, facial hair, right? None of it was severe.
Right.
But it was all little markers like something hormonal is not right in you.
Right. Yeah. I think that's an excellent point, because oftentimes if it's not severe or if it's not inhibiting us on a monthly or regular basis, we've just been taught it's normal. That's just a part of your period. Yeah. We've just been taught it's normal. but it's really not, right? It's really, our body is, I tell folks, anytime you're experiencing symptoms, it's your body sending those little red flags of, hey, I need some extra support somewhere, right? Something needs to be addressed. But if it doesn't last all month, it's just a few days, it's just, a week or two, and it fluctuates, right? Like, oh yeah, okay, it gets better, or sometimes we get busy and we don't even notice the changes, like a pattern in the changes. And so, we don't address it, or
We
it
do
doesn't become a
talk about,
priority.
like, I don't know, here's some birth control. I don't know, here's an antidepressant.
Yeah, exactly.
Right.
So
But it's not all, I don't believe it's all our fault as patients. I think some of us are doing the best we can and trying to say, hey,
yeah,
like, I don't think that I shouldn't be having acne at 30, like,
yeah, yeah. um that's I think you're right, is that um if your body is exhibiting symptoms, something's off. Yeah.
mhm.
And it may not be a lot off. It may just be, we just need to tweak things a little bit and support in different areas. But those are signs your body's trying to tell you something.
Yeah. And your birth control could be a root cause of some things that you're experiencing now, FYI. Mental health,
Exactly.
especially.
Especially mental health. Yeah. So it may be getting your periods under control. You're not miserable every month, but it can be affecting other areas. Yeah. So it's worth exploring, other options and trying to figure out, how to actually get to that root cause and make changes in your body.
And we're experimenting on me, people. So my neurotransmitter hormone test, I read the directions thoroughly. I'm supposed to take it at day 19 to like 20 something. So day 19 for me is going to be Saturday. So humans, I'm going to be sending my test off. It's probably Monday. And in another podcast episode in the future, we'll talk about results and
Yeah.
yeah.
We'll see where you're at.
All right,
Okay.
friends. Anything else, Carmen?
I think that's it for today. Thanks.
Hey, ladies, take power of that vagina and what is going on in there.